everyone, welcome to Pathways to Wellness. Today we're going to be talking about intro to Swedish massage. It's one of the basic massages that most of us experience if we go to a spa or a massage studio. It's just a very nice, gentle massage that we do here in the United States. But let's talk a little bit about what is Swedish massage. And when we think about it, like I said, it's the long, gentle massage strokes. They're flowing and soothing. It's a medium to lighter pressure, so it's not deep tissue, it's not trigger point, and it's just relaxing and calming. So like I'll demo here on my arm, so it's a nice, long, flowing stroke. Like deep tissue is going a lot harder, getting into the muscles, and trigger point might hold into it, but it's nice, long, and soothing. So let's talk a little bit about the history of Swedish massage and how it came about. In Europe in the early 1800s, per Henrik Ling, he was wanting to figure out how to, on a therapeutic level, on a medical level, to movement of the muscles and the tissue. And he actually had he was a fencing guy, and so he had some gout in his elbow. So he's trying to figure out how to work that out. But he wanted to do both active and passive, helping the client or the massage and the therapist to work together. It became known as Swedish. He was from Sweden, Swedish gymnastics. He had the Royal Gymnastics Central Institute. And also kind of just started invigorating and preparing athletes for their events. When it came to America, the Taylor brothers, they learned from Dr. Roth, who learned from Dr. Ling. And it became more of a Swedish movement massage, and then eventually became more soothing and relaxing in the lighter to medium pressure. And when we talk about Swedish massage, now I have 3 different books here, and these are different people that I've learned from, teachers. And what happens is each person talks about it a little bit differently. And so like this book here, they'll talk about how the Swedish massage was more of the medical and how it worked together by Mr. Ling, and he teaching and getting approval on the scientific community with some other people over in Europe. And then you have your traditional spa book. Hopefully that stays up. Your traditional spa book, and it talks about when you go there, it's a very elegant, soothing. You want to make sure everybody is just nice and relaxed in the spa environment. But like I said too, if you would go get a Swedish massage over in Europe, it's going to be more fast-paced. It's going to be trying to invigorate you. It's going to be a shorter massage. So just be aware of that if you're traveling and or you have a European type massage therapist work on you. There's a lot of benefits from the massage, and let's go over some of those. It helps increase circulation. So think about the whole circulatory system in your body as you're going over the skin. It helps increase that and makes that more balanced in your body. It increases the lymphatics. It helps you detox. So as we get rid of any of the toxins or any of the metabolic waste in your body, it'll decrease some muscle tension, decreases nervous tension. Also, emotional stress helps relieve that, and just overall relaxation. So again, the Swedish benefits are really amazing. There's also some contraindications that we need to be aware of. Just like any massage, we've been talking about them over time. And some of those have to do with if you're sick, you got a fever, flu, cold, you're contagious, you don't want to be trying to go and have someone else work on you. If you have skin rashes, infections, anything from, dermatitis is probably okay. You just have to be careful with the person that you're working with and they get their doctor's approval. But stuff like poison ivy or poison oak, you just want to make sure everybody's safe. If you've had an operation, you usually wait about 6 weeks, 4 to 6 weeks. Again, you get the guidance of their doctor. Acute injuries, inflammation, you need to have that calm down some. If you have varicose veins, you need to worry about the valve pressure and make sure that that's at a lighter touch for them. And of course, if there's varicose veins, avoid those areas and the blood clots. And chemo and radiation, a lot of people are going through that for their cancer treatments. So with that, we're going to actually have some people up here doing the demos, and so we're going to take a quick break, and I'm going to have 2 guests here, and we're going to show how Swedish massage works on each of them. So we'll be back in a few moments. Thank you. Welcome back, everyone, to Pathways to Wellness. We're talking about Swedish massage today, and I have my guest, Miss Linda Ryan, here, and we're just going to talk to her a minute. So you've come to me for a few times for massages, and why do you like massages, and maybe the technique I do for you?
Well, as you know, I like gardening.
Yeah.
And we have a big yard, and on one side of the house we have a fenced-in garden, not vegetables, flowers,
Oh yeah,
and
yeah.
a fish pond.
Okay.
So I spend a lot of time out there working,
Yeah.
and when I come in,
Yeah.
sometimes my neck hurts, my back's real stiff. I thought
Yeah.
you overdid it today.
Yep.
And I think it's time to go see Joan.
Well, there you go. So, as you can tell, she's a spring chicken. She's retired, but there's all kinds of needs for massage, and she's decided to help with her body and maintaining it so she can be out and doing her gardening. So she's kind enough to demo today. She's sitting on the table. We're going to go ahead and have her lay down. She likes to have a neck, under her neck, a pillow. She also likes her neck, but she likes a pillow underneath her neck. So that's why we have that there. And this will go underneath her knees. So I'm going to help her with just making sure she's comfortable. It's a narrow table, right? She's going to come down. I'm going to move that maybe just a tad. Okay. Is that in the right spot for you?
Yeah, that's good.
She's going to hand me her glasses. Remember, a lot of us can't see unless we have our glasses on our face. So that's common, right? I have my glasses on. So what we're going to do with the Swedish massage, and it's helpful if you have cream or if you have oil. I'm going to use this very basic massage cream. Has arnica and ivy in it, and she seems to be always okay with that when we use it. You always want to make sure they're okay. I'm going to do a little bit on my fingers. There's not much there, but just a little bit. And remember, I told you it was just a very nice and soothing massage. So she's got her arm here, and I'm just going to go ahead and just do a little bit of cream, longer, gentle strokes. What that helps is with moving the circulation. You can probably maybe see, because she's got her, veins there and arteries, and you just want to be very gentle, very soothing when you do this. You always go up towards the heart, up towards the lymphatics in her arm. We talked about contraindications in the past and today. If she had any lymph nodes removed, sometimes with cancer you do, and they're in the arm area, you want to make sure you go past that up into her neck. But nice, long, gentle strokes. Okay, I'm going to go down to her other side. I got a little cream on your neck there, sorry. So... Now, Linda was telling me, too, the reason she originally came to me, somehow you injured one of your shoulders. I'm not sure exactly what you did back then.
Right.
Yeah, you were like doing some kind of exercise and maybe overextended one of the shoulders, is that right?
Right. I got a little too enthusiastic, I guess.
So with that, I did do, the nice soothing Swedish massage, but then I also had to do a little bit of trigger points in her injury of her shoulder. And we had that Pathways to Wellness video a few months ago. And you can just do nice and gentle on the hands since she's working in the garden, pulling weeds or whatever you do in a garden.
Weeding, yes, that's
Weeding,
on the top of the list.
Raking. She's got a neat little fish pond too. She's always telling me stories about how they have to keep the fish, the vegetation in the water for the fish so they can eat and breathe and all of that. It's pretty intense. Okay, so I'm gonna put that down. Now I'm gonna go back and I'm gonna do her neck a little bit. And you see we have this headpiece here. If she was face down, she would be in the headpiece, but since she's face up, we don't need that. You still feeling okay? And of course, too, if you're in a studio, I'd ask, are you cold? Do you want a blanket on you? Or we're in summertime, so hopefully you feel okay temperature-wise.
Fine.
There's also can be heating pads on the table too. So here we go. We're going to do some around her neck, just nice and gentle. And I'm going to have her lift her head a little bit. I'm going to take this pillow out, which she doesn't always like, but she's going to come right back down into my hands, and I'm just going to go a little bit around her neck here, just trying to be nice and soothing. Again, you move down towards either lymphatics or towards the heart, just moving the skin, the fascia, just gently. I'm going to have you move your head just a little bit this way. We're going to do her other side. Probably can't really see it, but it's similar to what I was doing before. On her right side, the other side was left. What you can also do, and I have her head up. Normally her head would be down, but just so you could see, you can get the back of her neck underneath the head. Just nice and gentle for all of that. I'll put this back in there. Is that okay?
That's fine.
Okay. And a lot of people, either they might have acid reflux. I don't think that's in Linda's case, but sometimes they need that extra lift to their head. For her, she's just, the way her body is, she tends to have more of a curve in the neck, and she needs to have that support underneath it. Now, I didn't tell her this, but I'm going to do a little bit on her head. So she may have, she just got her hair cut, I think, yesterday, didn't you?
That's okay.
So I'm going to mess up her do a little bit. So that's kind of what we're doing here. We're just going to do nice, gentle strokes. Of course, if we were doing the whole body, I'd go down to her legs and her feet. I have another person that's gonna, her name's Judy, who's gonna be my body for that. But just to kind of review, we just go nice and gentle over the skin and just bring everything nice up. I'll do one more pass on the other arm so you can see that. All right, I'm gonna get her glasses and I'm gonna help her get up nice and slow. There you go, there's the glasses. Just out of her way. And then, yep, so I can help her up a little bit. She can put her legs over there. Make sure you're okay, you're together. Especially since you're on TV, right? So, how do you feel, Miss Linda?
Relaxed.
Yeah.
Yes.
And that was just a tease. That was only like 5 minutes, 10 minutes if that. But the whole point with the Swedish is just nice long strokes to relax you, to de-stress you, to move that circulation. Okay, well with that, we're going to take another little break and set up for our next person. And we'll be back in a few minutes. Thank you. Welcome back, everyone, to Pathways to Wellness. We're continuing to talk about Swedish massage, and I have my next demo person here, Miss Judy. She's been coming to me also for a while for massages, and I know recently she's had some challenges with walking, like sometimes we do, and she's had some knee surgery. And you're scheduled to have another
I
surgery
had
for
one
the...
done in March, and the next one's going to be done in the first part of September.
Okay, so she said March, and then in 6 months plus later, she's going to have the other one done. And what I've noticed from her recovery, what she's done with PT and other things, she's made a miraculous recovery. She looks so much better. I think you feel better too with the surgeries, right?
Well, the one lead, it feels great now. The other one you're still working on until it gets done.
Okay, there you go. And so what do you feel like with the massages? Why do you come for the massages?
To relax the muscles.
Okay.
Yeah.
Yeah. Cool. All right. So what we're going to do is we're going to start with Judy again laying down on her back, similar to what we did with Linda. So if you want to hop up on that table. And we're going to let her lay down easy. Now, I always ask you, do you want a pillow underneath you?
No, I'm fine.
So she's okay being more flat, where with Linda, we needed to have that pillow underneath her neck just for that, that support or that comfort. And so I'm going to focus on her legs. Now, this is the leg, which would be your right, where she had her surgery done last March. So you probably can't really see the
scar?
Scar. That's what I was trying to show people. And the other thing you can do too is put this underneath her knees so it takes the pressure off her low back. So is that okay?
Feels good.
Okay, feels good. So I'm going to use my cream again. We're going to do a little bit on this right leg, and then we'll go do her left leg. And remember again with Swedish, it's nice and gentle, long strokes. So it's just nice and soothing, going up into her hip area. Now obviously if she was getting a regular massage just like Linda, they would be underneath the sheets. We wouldn't be dealing with all the clothes, but for this filming, we've left the clothes on and you can see enough of the body parts. I'm gonna do that. So you can see my hands just go nice and gentle up and soothing. Again, if it was a deep pressure one or hard deep tissue, it'd be really deep, but I'm not. I'm going gentle. And then I think I was telling you guys earlier, with the European, it would be really fast paced. So it'd be really fast and invigorating and trying to warm up the muscles like this. But we're just going nice and slow. And this is where her injury was. I say injury, but her surgery. And when she came back, when she was comfortable and you got a release, it was almost a month, I think, before you had massage again. We kind of avoided this area. We went nice and easy, gentle with it. And then now that it's healed several months later, I can go over the scar tissue. She's gotten the release from the doctor to do that. Again, you always follow the doctor's advice. All right, so we're gonna put her leg back down. I'm gonna do the other one, which is her left leg. Again, I have my cream. I was using my cream earlier. And again, we'll just kind of go from the ankle up to her knee. If you were doing manual lymph drainage massage, which I'll have a filming on that here in the next month, we do more around opening the lymphatics, which would be up in this kind of groin area. But right now we're just trying to do nice, long, soothing strokes. I can go underneath, do the calf a little bit. Just nice and up into her hip area. Okay. There you go. Yay. And then what we can do too, I'm going to just get some of the excess cream off on this towel. As it comes up, we can actually go into the hips too and kind of into her glutes. So I'm just bringing the strokes on up. It's nice and gentle. Of course, now we want to kind of get into her back. So we have two ways to do it. I could actually flip her and she'd be face down and be in that head face cradle thing. But we're gonna have her just sit up. So I'm gonna help you get sitting up. There you go. Oops, there you go. Heard her crack. She's gonna face this way. And I am going to get untangled there. That was my mic. And I'm gonna sit next to her. Oh, I don't need the cream because I have her shirt. But now we're just gonna do some of that gentle massage on her back. Again, kind of bringing it up towards the healthy lymphatics, up towards the heart. If she didn't have healthy lymphatics here, they were removed, we could always go down and end up down here where some of the lymphatics is. That's more of a manual lymph drainage massage, but this is Swedish. It's just nice and gentle to relax her. You know, you can come up into the neck. I did that more or less for Linda. We'll cheat a little bit and give Judy some of that too. So that's how all that works. Again, this is just the basic massage that you'll see in most of the spas or massage studios or franchises if you go and get a Swedish massage. Now again, if you're European or if you're traveling over there in Europe, their massage is going to be more fast-paced, more vigorous. It's trying to warm up those muscles for athletic events. And the guy that gets credit for inventing this type of technique or bringing it more mainstream, I meant to say, he did it more with the movement, the gymnastics of the body. That was Ling. All right, I think with that, we're kind of pretty good. So I'm gonna have her somehow flip around so you can see the camera again, so you can get off the table and walk around. Oh, there she goes. Look at that. She can flip around. All right. So how do you feel, Miss Judy?
Very relaxed.
Yeah.
I'm just going to stay here for a while.
You're going to stay here? Well, there you go. She'll be the rest of the show. Yeah, it's one of my favorite massages to give and to receive myself. I mean, a lot of people like that deeper pressure and deep tissue, and that can be effective too. But, you know, for a lot of people, you just really just need to move the fascia, the skin, the dermis, and then also just get into circulatory and the lymphatic system. So, and then she has her next surgery here in about a month, right? Or 6 weeks? Yeah. So then she'll take a leave of absence from me for a little bit, and then I'll probably see her later in the fall. But, all right, well, with that, we're going to go take a break, and then we'll come back for a summary and a wrap-up. All right, we'll see you in a few minutes. Welcome back, everyone, to Pathways to Wellness. As we're doing our little intro to Swedish massage today, we've talked a little bit about what it is, the benefits, the history, the contraindications. And I've got my two lovely guests here, Miss Linda and Miss Judy, who help demo the different parts of the body. But let's go ahead and let's look at the review. We'll put that slide up there for a minute. So there's two types. There's the European Swedish massage and there's the American. And I do make a distinction because if you're out traveling and you get a Swedish massage, you're over, overseas, it's going to be usually a faster pace, more invigorating, where the American is more soothing, elegant, and just trying to relax. And again, you've got the long gliding and gentle massage strokes, a medium to lighter pressure. It's not a deep tissue massage. Helps increase the circulation and lymphatics. It also detoxes, de-stresses, and relaxes. Of course, you want to avoid massage if you're sick, skin conditions, acute injuries. Also avoid with maybe the varicose veins, or at least be careful with that and the blood clots, and if you're receiving chemo and radiation. And we demoed on different parts of the body. So let's come back, and I'm going to talk a little bit to Miss Linda, our first guest, and just kind of review. And again, why were you seeking the massage, and what helped you for you and your overall health and your wellness?
Right. Well, as I said, sometimes if I overdo it with the gardening, my neck will hurt. just feeling like my back is all knots and not too good.
Yeah.
So, but after the massage, I kind of feel more invigorated, more relaxed. I'm ready to get back in there at those weeds.
Well, and I'll also say too, when she usually leaves after a massage, she treats herself. Lots of times she'll go get that ice cream cone before
Oh, yes.
you.
Yes.
There's a little ice cream studio or ice cream store close to us. And then with Miss Judy, then you've been coming to me for a while, and I know you were doing it for also relaxation. And so just tell us a little bit about why you were seeking out the Swedish massage, why it helped you.
Well, originally I am a bowler, but with the knee issues that I've had, I've kind of had to give that up for the time being. But even before the knee issues, I was coming to you for relaxation from bowling, from standing up quilting for 3 hours at a time,
Yeah.
just to relax myself.
There you go. Yeah, so we have some pictures here of, I'm not sure if we already saw them, but we had one with Linda being peaceful in her garden, and I mean, look at that garden. And then we've got Miss Judy there with her quilting fun, and it's just nice that that you can seek out different types of therapeutic wellness to, you know, rejuvenate your body. So with that, it's nice to have the opportunity to help you guys out there in the public to understand the different types of the massage. Again, remember, it was a nice soothing, long massage versus the Europeans, faster pace and trying. And Olympics are around the corner, so you might see more of that type of getting the athletes ready. And I just want to thank everybody that was here today. So I want to thank my guests, Miss Linda and Miss Judy. And also I want to just thank the viewers for tuning in and learning more about your pathway to wellness, and then particularly today, the Swedish massage. So until next time, you guys have a good one out there, and thank you again.